All right. So, had left off last class with basically we had gone through the mechanisms by which a skeletal muscle fiber could contract, and we went through the different fiber types. Well, what I want to do now is I want to start to get into the specific muscles of the axial skeleton. And if you recall, the axial skeleton is that part of our skeleton that includes our trunk, as well as our vertebra, our rib cage, our head, and our neck. Right? Our arms and legs are called appendages, and they make up what's called the appendicular skeleton. So we're going to start on the axial skeleton first. Okay, so where I left off was basically with this slide, and before we even identify specific muscles, I'm going to identify some of the roles that are played by these muscles. And a given muscle can act, some of them can act as all four of these and play all four of those roles. Okay, so what we got is we're going to use the biceps brachii as a good example here. Right? And the biceps brachii is this anterior forearm muscle that crosses the shoulder joint, produces movement at the shoulder as well as at the elbow. This muscle spans both of those points of rotation for those joints. So most muscles are going to have what's called an origin and an insertion. And this is going to be most of the time on bones. Now, they're both attachments. Okay. The origin of a muscle is typically located more proximally, so closer to the trunk, and insertion points of a muscle are, in opposition, typically located more distally or further away on the limbs, away from the trunk. So in this case, when we get into the biceps brachii, we'll find out the biceps brachii has two heads to it. But this long head of the biceps brachii, it originates from something called the supraglenoid tubercle, which we'll get. There's a little bump on the scapula. Right? And then as it travels all the way down, these two heads will merge and it will insert onto something called the radial tuberosity of the radius, one of the bones in our forearm. Because the muscle crosses both joints, it can produce actions at both joints. This muscle can cause flexion of the shoulders. It can also cause flexion at the elbow, as well as it can supinate the forearm as well. But it can produce far more movement, range of motion at the elbow than it can at the shoulder. So you'll find that most of our insertion points of muscles are also at areas that produce more motion. They're more mobile. Okay, so say I flex my elbow, right? So if I flex my elbow, I do this. Right? Now, during that movement, the biceps brachii, it helps produce that movement, but it's not the only muscle that does it. As a matter of fact, the major muscle, the muscle that does most of the work for elbow flexion, is called the brachialis. So because this muscle does most of the work in producing a joint movement, that muscle is called the agonist muscle. Now, biceps brachii, it helps the brachialis. So it's called a synergist muscle during elbow flexion. Okay. Now, biceps brachii, it can produce an action at the shoulder, but other muscles can produce more of it. So they would be agonists, and the biceps brachii would be a synergist for shoulder movements too. All right. Now, say I want to flex my elbow. All right. I've identified the agonist muscle and the synergist muscle. As I flex the elbow, I'm going to be stretching out this muscle on the posterior side of the upper arm, of the brachial region, called triceps brachii. Right now, muscle tissue acts like a rubber band. If you stretch it beyond its resting length, it will build up this passive restoring force, this elastic recoil that will cause the muscle to kind of snap back like a rubber band. Right? So as you flex the elbow, this elastic recoil gets greater and greater and greater the more you stretch the fibers of triceps brachii. And the more it's stretched, the more force you have to produce in these agonist and synergist muscles to overcome that passive restoring force, that elastic recoil that's building up in this muscle. So you could think of the muscles on either side of the joint here, they work in opposition to each other. If this is an agonist, this one that works against it or makes it work harder is the antagonist muscle. Now say my elbow is flexed and I want to rapidly extend my elbow. Well, now the triceps brachii is going to become the agonist muscle because it's going to be primarily responsible for producing that action. In this case, and while it's extending the elbow, these muscles on this side are stretching out. So these would be considered antagonist muscles during elbow extension. And if you went back and forth, elbow flexion, extension, the muscles would take on alternating roles. Biceps brachii agonist, triceps brachii agonist, so on and so forth. During elbow flexion, triceps brachii is the antagonist. Biceps brachii is the antagonist during elbow extension. Okay, now what's also shown here is like, hey, we've got this bone here called the scapula, right? And there are muscles that attach our scapula to our vertebra, right? And they can basically hold the scapula in place, prevent the scapula, which, by the way, if you call it the shoulder blade, don't expect to ever get any points for calling it the shoulder blade. It's the scapula. Just got to get that out there. When you produce these movements at the shoulder, these muscles over here help prevent the scapula from just sliding around all over your back, right? So they kind of hold it in position and make sure that that movement you're trying to make occurs at the shoulder or at the elbow. So these muscles here, which are known as rhomboids, and we'll get to those, they act as stabilizers or fixators. They hold bones in place and allow movement to occur at other movable joints. Okay, well, like I said, muscles can take on these different roles depending upon the movement that's being produced. All right, so now I'm going to get into, we're going to start identifying some of the muscles here, some of these specific muscles. For these muscles of the face and for facial expression, I am not going to hold you responsible for the origins and insertions of these muscles. Okay, I just want you to be able to identify them, know what they do when they contract. And when I say contract, I mean concentrically contract, like what happens when that muscle shortens and contracts. Now, one thing all of these muscles have in common, listed in blue, is that they're all controlled by the exact same cranial nerve. It's cranial nerve 7. That's what this is up here. CN7 stands for cranial nerve 7, which is also known as the facial nerve, which is kind of cool that the facial nerve controls the muscles involved in facial expression. And this image is kind of split in half. On this side of the screen, you're seeing the superficial musculature just deep to the skin. And if you peel those away and look deep to those, that's what you see over here. These are the deeper muscles in some cases. All right, so the first one, frontalis. There are more difficult muscles to remember than frontalis. I mean, it's right there. It's kind of attached to your like frontal bone, right? And when you contract this muscle, it will elevate your eyebrows and wrinkle the forehead skin. So there, I have concentrically contracted my frontalis muscle. I'm going to relax it and contract it again. Right? Now, if I want to furrow my eyebrow, depress my eyebrows and bring them down like I'm scowling, then that action is controlled. If you look deep to frontalis, there's a muscle there, which I love. It's called corrugator supercilii. I love that, the name of that, because when you contract it, it kind of makes your eyes look supercilly. Corrugator supercilii. Anyway, but so these are the agonist-antagonist pairs to either elevate or depress your eyebrows. All right, surrounding each one of your eyes is this kind of round, circular, orb-shaped muscle called orbicularis oculi. Again, I think I mentioned before, if you don't like Latin, this is going to be painful for you. But gotta just get past it. You can get a lot out of the terms here. Orbicularis tells you the shape of the muscle. Orb. All right, where is it? Oculi. Ocular, surrounding the ocular cavities, which is where our eyes are. So you contract orbicularis oculi, and it basically squints, or it narrows. They act like a sphincter, if you will. They kind of close around our eyes. Kind of like that. Relaxed, squinting. All right. If you go just inferior to the orbicularis oculi, there are two muscles that actually originate from the zygomatic bone, which is this bone right here, colloquially known as your cheekbone, but 0 points for calling it a cheekbone. It's the zygomatic bone. But it originates right here on the zygomatic bone, and then kind of inserts into the corners of the mouth. Right? So, and there are two of these muscles on each side. One is bigger than the other. So one's called zygomaticus major. That's the more inferior. And then the one that sits superior to it is the zygomaticus minor, excuse me. A little bit smaller. But you can imagine when both of these muscles contract, when muscle contracts, it's going to pull on its two attachment points. Well, your zygomatic bone isn't going anywhere. It's not going to move. However, it inserts onto the corners of the mouth, right? When that muscle contracts, it will pull the insertion point closer to the origin, which will pull the corners of the mouth up closer to your zygomatic bone, which is smiling. You know, I can't talk and demonstrate it at the same time, but you get the idea. Corners of your mouth move up. You're smiling. That's how you do it. All right. So if you move over here, first, just like there's an orb-shaped muscle surrounding the ocular cavity, there's an orb-shaped muscle surrounding the opening to the oral cavity, and it's called orbicularis oris, shown right here, this one right here, surrounding the lips, sometimes known as the kissing muscle. I don't come up with this stuff, and I just relay it, because if you purse your lips, then you're contracting orbicularis oris to do that. We also use this muscle to help shape the air that we're forcing out of our bodies in order to produce sounds. Another muscle that helps with that, it lines our cheeks, right, which is known as the buccal or buccal region of the body. So the muscle you find there is known as the buccinator. And we help use this for mastication, like chewing. Right? We use our tongue. We put something in your mouth. You use your tongue to situate it in between your teeth, and then you bring your teeth together and grind up the food. What helps manipulate that food in your mouth, in addition to your tongue, is the sides of your cheeks. If you tighten the sides of your cheeks by contracting the buccinator, it provides a more stable surface with which to form this bolus of food that you're going to swallow. Now, when we speak, we're forcing air up and out, and as it passes through our pharynx and into our oral cavity, we use our tongue, the buccinator, as well as the orbicularis oris muscle to shape that air into words, or intelligible sounds at least. All right, the next muscle shown here is this kind of sheet-like muscle that covers our anterior cervical region, or our anterior neck. Known as the platysma, and the word horror is there because if you make a horrified expression, you will contract your platysma. All right, like I don't know. I'm not really horrified. I'm horrible. I'm horrible at showing the horror expression. Excuse the accidental humor. Okay, but it is this sheet-like muscle. That's where you find it, and it kind of pulls the skin tight on that region when it contracts. All right, so here we go. Talked about mastication a little bit, right? Like the buccinator helps compress the sides of the cheeks when we chew. There are other muscles that are also involved in chewing, mastication. And these two of them are known as the masseter and the temporalis, respectively. The other two are on the next slide. They're the medial and lateral pterygoids. But for now, the masseter and temporalis. Masseter originates... oh, come on, cursor. My cursor not move now? Okay, There we go. There's the masseter. So it's going to originate up here, again, from the zygomatic bone, this little arch right here, and it will extend inferiorly, and it will wrap around the this projection of bone here called the ramus and the angle. This area right here, or on a model, this is the ramus, and the angle, and then the body of the mandible. So masseter is going to wrap around, extend through this ramus, wrap around the angle of the mandible. And when it contracts, it's going to pull on its two attachment points. Once again, zygomatic bone's not going anywhere. But the mandible can move. It can pivot right there during depression and elevation of the mandible when we open and close our mouth. Right? So when you contract the masseter, it's going to pull this angle of the mandible up towards the zygomatic bone, which is elevation of the mandible. It will help close our mouth. And this is on both sides of the mandible, right, which is going to help, crush food that's in between those teeth. Another muscle that helps, also part of the TMJ, temporomandibular junction. Temporomandibular junction is where the temporal bone articulates with the mandible. And that's where the rotation of the mandible occurs during elevation and depression, during opening and closing. There is this muscle here that originates from the temporal bone, kind of appropriately named, right? Temporal bone, kind of the lateral side of the skull. And it inserts onto this little spike of bone on the mandible called the coronoid process. And you can see it here on this model. This is the coronoid process. All right, so it begins up here, extends down and inserts onto this. So it has like the similar action to the masseter. Right, you contract it, it's going to pull this coronoid process superiorly, which will help elevate the mandible. Now you can see that these fibers here, when they contract, they're going to pull this coronoid process superiorly, almost directly upward. But these muscle fibers back here, they run at a different angle. All right, and when you contract a muscle, you don't have to contract every single muscle fiber in that muscle, right? We can pick and choose which muscle fibers by activating different motor units. Well, if I activate these motor units and these muscle fibers back here, because of their attachment point, their angle of insertion, they're going to actually pull that coronoid process in posteriorly back towards this direction. And that movement, that posterior movement, I can't do it on the model, is called retraction. Now, I'll show you from a sagittal view. I will protract and then retract my mandible. So protraction, retraction is when I pull it back. And you can obviously go back and forth with protraction and retraction. Temporalis, these fibers, they're going to retract it and pull it posteriorly. All right, so the other two muscles that do play a role in mastication, in addition to masseter, temporalis, orbicularis, oris, buccinator, the tongue, the other muscles there, the medial and lateral pterygoids, the P is silent, it's like pterodactyl, pterygoids, they will help produce what are called excursion movements at the temporomandibular joint. And again, I can't do it with the model, but I can demonstrate it. It's basically the side-to-side movement of your mandible. There. So you can protract, retract, and have excursion movements, side-to-side movements. And again, you look at the origins of these two muscles, similar origin. They both originate from the sphenoid bone. Excuse me. Now, the insertion points are slightly different. Whereas the medial pterygoid shown here, it's going to insert again onto the ramus and the angle of the mandible, except this time on the medial surface, as opposed to the lateral surface where the masseter inserts. And compare that to the lateral pterygoid that originates back here from the sphenoid, and then it actually inserts onto the mandibular condyle, that feature right there that forms the temporomandibular joint. I mean, this is where rotation occurs during elevation and depression. So it can, because it has this kind of lateral approach to it, They can produce excursion, but when it contracts, the sphenoid bone isn't going anywhere, but the mandible can slide forward a little bit. That's protraction. All right, so if I protract and retract, I am contracting my lateral pterygoids and then my temporalis muscle to retract it. All right, moving on from the facial muscles and the head muscles, we're going to work our way inferiorly down the axial skeleton. So we're going to get to muscles that act at the neck. I've got them listed here. We'll run through each of those on the anterior and posterior side of the neck. So starting with the anterior side, sternocleidomastoid. Wow, what a great muscle. What a fun muscle to say. I love how you can get like all the attachment information out of the name of this muscle. Right? It's a two-headed muscle. Part of it originates from the sternum. That's the sternal part. Part of it originates from the clavicle, not the collarbone. Don't call it the collarbone. It's the clavicle. So the sternal clavicular heads ascend and they insert onto that little bump back here behind your ear, which is this feature right here, which is called the mastoid process. Okay, so again, from a side view or a sagittal view, you can see it running in this direction. In a frontal view, you can see both sternocleidomastoid muscles on each side. And if you contract both of these at the same time, all right, for all these muscles, it is critical that you know how the muscle crosses the joint. Does it cross on the anterior side? Does it cross on the posterior side? Does it cross the point of rotation laterally or medially? Because how it crosses the joint, which is the point of rotation, is going to determine what kind of muscle action can be produced there. Now, so use sternocleidomastoid, right? It crosses anterior to the point of rotation. Rotation occurs in between my vertebra, right, or in between my occipital bone and my atlas. But the muscle crosses anterior to the point of rotation. So when it shortens, it's going to pull my chin down towards my sternum. That's called flexion, neck flexion. Now, if the muscles that cross posterior to the point of rotation, they're going to extend and hyperextend. Right, but bilaterally connect both at the same time, you get neck flexion. If you only can, and again, you don't have to contract both of them at the same time. You can choose, hey, I only want to contract my left, because it's this person's left, the left sternocleidomastoid. Well, okay, if I only contract this one, this mastoid process is going to get pulled towards my sternum and clavicle, and that's going to turn my head to the right. All right, so I'm contracting the left muscle, and I'm going to get right head rotation. Because it's towards the opposite side of where the muscle is located, that's called contralateral rotation. Right? So if I contract my right sternocleidomastoid, I would get left head rotation. All right, still on the anterior side, we got the scalenes and the prevertebrals. Scalene muscles, you got three of these. They're known as scalenus anterior, scalenus medius, and scalenus posterior. They all originate from the second through the seventh cervical vertebra, these transverse processes over here. And then the muscles run down and insert onto the superior surface of your first two ribs. Scalenus posterior actually is the one that inserts onto rib 2. Medius and anterior, they insert onto rib 1. But you got the scalenes over here and the scalenes over here. They cross laterally to the point of rotation is right here. Imagine it's running right through the middle of the vertebral column. These muscles, the scalenes, they cross that joint laterally. So when you contract this side, right? Say this is the left side of this image, even though it appears in your right visual field. That's something else. If you contract these on the left side of the image of the person, then you're going to pull the neck towards the left. That's called lateral flexion. If I contract my right side scalenes, I'll get lateral flexion to the right, or lateral flexion of the neck to the right. Right lateral flexion. And because they insert onto the ribs, they are synergist muscles for respiration, for breathing in. Something called inspiration. It can elevate those ribs a little bit, and because our lungs are basically attached to the insides of them, if the rib cage expands, so too do our lungs, and that creates a little vacuum that sucks air into our lungs. That's how we take a breath in. So these are synergist muscles for respiration. Those are the scalenes. Then you have I've got two prevertebral muscles for you to know, called rectus capitis anterior and rectus capitis lateralis. Rectus means straight. So all the fibers in these two muscles all are parallel to each other. That's the whole rectus part. They both insert onto the occipital bone, which is part of the head. In Latin, the term capitis refers to head. So straight muscle attached to the head, rectus capitis. One of these, they both insert onto the occipital bone, but one attaches at a more anterior location than its origin. Rectus capitis anterior. Right? When that one contracts, it's going to help flex the head at the neck. This rectus capitis lateralis, by the name, has a more lateral insertion, and when this one contracts, it'll pull the head to the side, which is called lateral flexion. Left lateral flexion of the head, right lateral flexion of the head. All right, those are the anterior muscles, those on the posterior side. Again, these are going to produce extension movements of the head at the neck, shown down here. Extension. Splenius actually means bandage. I don't know why the person thought that this looked like a bandage when they found it, so they named it splenius, and it attaches to the head, splenius capitis. There's another splenius bandage-looking muscle that inserts onto the transverse processes of our cervical vertebra. So that one's called splenius cervicis. Right. So both of them are posterior muscles. They both run posterior to the point of rotation in the vertebra. So when they contract, they will extend or hyperextend the head at the neck. If you contract just one side, just this right side splenius capitis, it can produce rotation of the head towards the right side. It'll pull this point closer to this point. So that's ipsilateral, or same side rotation. If I contract my left splenius capitis, I would get left head rotation. Okay. Moving on to muscles of the trunk. We'll identify, again, the anterior musculature first, then those involved in respiration, and then move to the posterior side. All right, muscle that most people have heard of at some point in their lives, called rectus abdominis. Rectus, straight, right? Look at all the muscle fibers in this muscle. They're all parallel to one another, right? So straight muscle, where's it found? Abdominal region, rectus abdominis. Right, it's got its origin down here from the pubic crest, like the superior part of your pubic bone, as well as that little disc of fibrocartilage that connects them, called the pubic symphysis. And then the muscle runs superiorly up here and has multiple insertion points on the xiphoid process, that little piece of cartilage at the inferior end of your sternum, as well as the anterior surface of ribs number 5, 6, and 7. There's the attachment there on 5, 6, and 7, the last 3 of your true ribs. Again, rectus abdominis is kind of unique in that it has different muscle bellies to it. You can see there's 1, 2, 3, 4, 5 of them on each side, and each of those muscle bellies is separated by a line of connective tissue called a tendinous inscription or a tendinous intersection. Different texts use different terms. You're probably going to see them both, right? You got to know what both of them are, even though they're talking about the same thing. And sure enough, you've probably known someone, it may be yourself, who has exercised those muscles, the different muscle bellies, and you can see each of those muscle bellies defined through the skin. So that person has like the 6-pack or 8-pack abs. Great. Good for you. Awesome. There was a time once, but no longer. All right. Anyway, and then this is the right side rectus abdominis. There's the left side rectus abdominis, and those two muscles are joined by a thick line of connective tissue that runs right down the middle here, called linea alba, which linea alba is Latin for white line. You'd like to think it's something a little bit more intricate, romantic, but it's not. White line. So and embedded in that linea alba is the umbilicus, right? Your belly button, navel. When this muscle contracts, all right, it's going to produce trunk movements, right? And because it's on the anterior side, it's a really anterior muscle. It's going to pull this attachment point closer to this one, which is going to cause you to bend over, which is known as trunk flexion. All right. This is one of the 4 abdominal muscles. 2 other abdominal muscles are known as the internal and external obliques. And again, you can get something out of the name of the muscle. One is going to be more superficial and one's going to be more deep. The one that's deep, internal. The one that's superficial, external. And both of these muscles have muscle fibers that insert at different angles. The term for angle is oblique. So I have it listed here. The IO refers to the internal oblique. EO refers to the external oblique. So this up here, here's a view of the internals and the externals down here. Right, the kind of reversed origins and insertions between internal and external oblique. I'm not going to read them to you, but the iliac crest, that's if you put your hands on your hips, you're kind of resting your hands on top of this region right here, which is the iliac crest. That's where the internal oblique originates, and then it runs at these angles and inserts onto the ribs and the cartilage that attaches the ribs to your sternum, as well as an expansive connective tissue right here called an aponeurosis. Now, when you contract the internal oblique, it's going to pull this center region right here towards the iliac crest, right? So if I contract, and this is the right side, if I contract my right internal oblique, I will get rotation to the right trunk rotation, which is on the same side, so it's called ipsilateral rotation. If I contracted the left side internal obliques, I would get leftward trunk rotation. I'll come back to these special notes here in just a second. Compare that to the external obliques. All right? Again, their point of origin is the ribs, and they actually insert onto the iliac crest. Instead of originating from it, they insert on here, as well as this expanse of connective tissue, another aponeurosis. This one's actually called the rectus sheath, if you're interested in that, and all the way to linea alba. Now, when this muscle, the external oblique, contracts, now what's going to happen, right? The ilium's not going to move, just like it didn't move up here. But the angle of insertion of these fibers is such that now these ribs are going to get pulled downward and inward. Right? So if I contract the right side external oblique, I'm actually going to get left side trunk rotation, get contralateral rotation. So if this is a view of the right side, I contract the right external oblique, the right half of my ribs gets pulled towards the middle of my body, which is going to turn my trunk to the left, which is contralateral rotation. Both of these are also still anterior to the point of rotation, because the point of rotation is vertebra, the vertebral column. So these are anterior to that, so they will also assist in flexion of the trunk. And because these muscles, they actually line the abdominal cavity, when we contract them, they squeeze on our visceral organs, our abdominal, the contents of our abdominal cavity, right? Our intestines, our stomach, our liver, and things like that. They get squashed, which sometimes forces them up against our diaphragm and helps us expel air. right? So if you have to cough, you'll notice you'll take like a little bit of air first, like no one's here, so I'm okay to cough. I'm not like coughing on anyone. When you breathe in, you then feel you're going to create this intra-abdominal pressure. You're going to contract these abdominal muscles in order to force that air out. Like, try coughing and feel what happens in your abdomen when you do it. You can feel that tension being produced. All right, now the last of these abdominal muscles. Again, you get a lot out of it. From the name of it, transverse abdominis, sometimes called transversus abdominis. If you want the full Latin experience, that's fine. This is the deepest of the abdominal muscles. Actually lines the abdominal cavity, like the serous membrane, the peritoneum that lines our abdominal cavity. Right? This is the last muscle right here, transverse abdominis. This is a cross section. If you sliced right through here and flipped it and rotated it, here's the outside world. Here's the abdominal cavity right here. There's the peritoneum that lines the abdominal cavity, and then there's a section of transverse abdominis beginning here, and your other transverse abdominis over here. Then you'd have the internal oblique and the external oblique, kind of this layering system of muscles forming the abdominal wall. And then anteriorly, right in the middle, there are the two cross sections of the rectus abdominis separated by linea alba. So all of these abdominal muscles, rectus abdominis, the two obliques, as well as transverse abdominis, they're all involved in creating intra-abdominal pressure, compressing the contents of our abdominal cavity, as well as the obliques also and rectus abdominis being able to produce trunk movements. All right. So some of these respiratory muscles, right? Breathing's fun. Breathing is nice. Most people like it. And breathing in requires muscle activity. Breathing out at rest, it's a passive process. You really don't have to do anything. But breathing in requires contraction of muscle. And about 70% of like just sitting there at rest and taking a breath, roughly about 70% of that's controlled by this U-shaped muscle that separates our thoracic and our abdominal cavities, called the diaphragm. Right? And when there's a lung right here and a lung right here, they actually are attached to the top, the superior surface of your diaphragm. And when you contract the diaphragm, it depresses, it kind of flattens out, which pulls your lungs kind of down with it. And if your lungs are like a balloon, if you stretch out your lungs, it's going to create a vacuum that sucks air in, right? And hey, congratulations, you just inspired. You took a breath in. Okay. That's inspiration. Now, as I said, diaphragm does most of the work. Right? It is assisted by another set of muscles that you find in between your ribs, right? And the term for ribs is costal. So we've got two sets of these. There's what are called the external intercostal in between ribs. And then if you look deep to that, you're then going to have the internal intercostals. And just like the different oblique muscles, the internal and external intercostals attach the ribs at different angles. The external intercostals, when they contract, they pull these ribs upward and outward, which helps expand our rib cage. If you expand the rib cage, you're stretching out the lungs too. It's going to help draw air in for inspiration. And then say you're done taking a breath in, stop contracting your diaphragm and external intercostals, and they will return to their original position. The lungs will be squeezed, air will get forced out. But you don't have to contract muscles to do that, not at rest. Now say you start to exercise, right? You're running in place. Now you're going to have to help expel air, right? You're not going to be able to get rid of that CO2 that's building up as a result of working muscles fast enough. So you're going to have to contract muscles to forcibly squeeze your lungs. One of the groups of muscles that does that, well, the abdominal muscles help, but also the internal intercostals. Their line up, the way they connect adjacent ribs is that when they contract, they don't pull the ribs up and outward. They pull the ribs downward and inward. That actually squeezes our lungs and helps force air out. Right? So this is only during forced expiration. Expiration at rest is a passive process. It does not require muscle activity. Now, for inspiration, these are not the only two muscles that help. Remember I mentioned those scalenes? The scalenes attached to the first two ribs, they can help with inspiration. Sternocleidomastoid can actually help a little bit too by elevating and expanding the rib cage. There are others, like serratus anterior, but we'll get to that, right? But they would be synergist muscles. Diaphragm's the agonist. External intercostals are the primary synergist muscle. All right, so now we get to the posterior muscles of the trunk. I'm going to go through those that are found superficially, and then intermediate, and then those that are deep. All right, so these intermediate fibers, actually the superficial muscles of the back, we'll get to those. We're going to go deep to those first. You are not responsible for all of these terms over here, okay? Just so relax on that. There is a group of muscles that are collectively referred to as the erector spinae group. I know it looks like spinae, but that's not Latin. That's not correct Latin pronunciation. It's spinae. And so you could break this muscle group down into three major subcategories or subcompartments. Right? There is one of them that basically runs all the way along. It parallels the spinal cord. Runs right along the middle of the posterior thorax, posterior trunk. That group of muscles is then called the spinalis group. If you work your way just lateral to either side of it, right, that's where you find the longest muscle fibers of the erector spinae group, and that group is known as the longissimus. And then you work your way even more laterally or to the side, you'll come up with one that runs from the ilium and inserts onto the ribs. Right? Proper word for ribs is costal, so iliocostalis. So going from medial to lateral, spinalis, longissimus, iliocostalis. All of them make up the erector spinae group. All of them run posterior to the point of rotation, so all of them will produce extension and hyperextension of the trunk. Now, each one of these can be broken down. There's a thoracic part of the iliocostalis. There's a cervicis part to it. Don't worry about that. Know these three groups, how they're organized, and that they're a part of this muscle group, and what happens when those muscles contract. All right. Now, if you go deep to the erector spinae group, we're not covering like all 600 different muscles in the body. I'm not going to ask you to know the different subcompartments of the semispinalis muscles. There's a capitis, cervicis, and thoracis. So what? For our purposes, know that the semispinalis group, along with the multifidae, or the multifidus, and this other muscles called the rotatories, they're all on the posterior side of the vertebra, posterior to the point of rotation. They're all going to be involved in trunk extension. But they're small muscles. So these are not going to be, the erector spinae group is probably going to be the agonist muscle for most trunk extension. But the semispinalis and the multifidae and rotatories, they can help. They're synergist muscles. And the rotatories, come on, it's in the name, man. They're going to produce rotation. Rotate. And in this case, if I contract this rotatories muscle, it contracts and it will actually cause my body to turn to the right. That would be contralateral rotation. It would pull this towards this. All right. Again, I have all this up here. I love all this stuff, but your job on this is to know that these muscle groups exist. I'm not going to ever ask you about the origins and insertions of any of these transversospinalis muscles. All right? Just to be clear. These I will. What are called the segmentals. All right, quadratus lumborum is down here. We'll get to that one. It's pretty, actually, we'll do quadratus lumborum first. It's pretty straightforward. Quad, four evenly length sides to it. Attaches to the lumbar vertebra. Right, originates from the iliac crest, inserts onto the transverse processes of lumbar vertebra, and it will produce, it's going to pull to the side. Point of rotation's right here. So it contracts, it's going to pull laterally. It will laterally flex your trunk. These two sets of segmentals, one called the interspinales, the other called the intertransversarii. Right? This requires you to remember a little bit about the skeletal system and skeletal anatomy. Right? With a typical vertebra, sticking out the posterior side of each vertebra is a process called a spinous process. So here's a spinous process of one vertebra. Here's the spinous process of another, and you just work your way all the way down. Now, most vertebrae also have these other processes that are kind of oriented in the transverse plane. So there's a transverse process of vertebra, and there are three more on that side. All right, so the names of these segmental muscles kind of make sense, right? The interspinales, well, they're in between the spinous processes, right here and right here, interspinales. Right? And the spinous processes, these are all, they're all run down the middle of your back, so they're going to help extend and hyperextend the trunk. Now, here again, here's another view of those rotatories, right, from the previous slide. But in between this transverse process and this transverse process, well, intertransversarii. Here's another intertransversarii. There's one over here. There's one over here. And here and here. All right, so when all of these on this side contract, all of these transverse processes are going to get pulled closer to one another. And when that happens all the way along the vertebral column, you're going to lean in that direction, which is called lateral flexion. You contract your left intertransversarii, you'll get left lateral flexion of the trunk. Contract the right intertransversarii, right lateral flexion of the trunk.